So when we hear about the ADN versus the BSN, a lot of persons are a little bit confused, and sometimes, you know, they're not so sure which one to choose, and everybody have their own opinion. But we're going to talk about it because it is very important and it should matter to you which one you choose, especially when you think about your life, your career, your journey in nursing. So if you're becoming a nurse and you're thinking about that big decision, then I want you to go ahead and, you know, just think about it. Don't overcomplicate it. Just think about what is it that you're looking for. And then from there, you choose a pathway that aligns with your goal. So the ADN is a 2-year nursing program and the BSN is a 4-year nursing degree. One is shorter and one is longer. But in the end, both of them are going to take you to the same, you know, the same exam. You're going to be sitting the NCLEX after you finish. You're writing the same NCLEX exam to become a registered nurse. That's just it. The difference between the two is that when you look at the Bachelor's of Science program, one of them opens a little bit more doors long term for you, because when you think about if you want to go into leadership, management, some hospitals prefer Bachelor's of Science. The ADM gets you into the workforce a little bit faster. The BSN is going to cost you a little bit more money and time up front. The ADN can bridge you to the BSN program while you're working. So the difference is not better, you know, you being a better nurse. It's just the strategy, and that's just it. So some people, I know sometimes people will look at the ADN route and think that you're not a good nurse or you're not good enough. But that's not true, because I know a lot of persons with associate degree and they're wonderful, they're great nurse. But it doesn't change anything. A focused discipline, you know, ADN nurse will outperform a distracted Bachelor's of Science nurse every time. So it's all about the mindset and their work ethic that matters. It's not about the amount of letters in their, you know, in their title. So if you are somebody that is wanting to start like a job very, very fast, if you want something that is very affordable, if you're planning on bridging later on, then I would say choose the ADN route. If you want to do like, you know, a leadership, you want to become a nurse practitioner, you want to go into education, and you have the money, the time, and you can commit to that, then definitely you can go on to the Bachelor's of Science. That's what you're going to go ahead and choose. But don't go ahead and choose something that is going to be based on pressure, something that is going to be based on your life. So if you know that your goal is to, you know, become something more than just a nurse, yes, you don't want to just become a nurse. You want to do something long term, then choose based on that pathway. So whichever pathway you choose, make sure that you commit to it fully. So if you know that you want to become a nurse practitioner, you want to become the director of nursing for this university, go on and start off with your Bachelor's of Science. So you have to know what you want to do long term in order to choose or start off. Well, you can start off, you know, but then you don't want it to be a case where you just seem like you're wasting time and money. But if you know what you definitely want to do long term, that will have you choosing the right pathway or the right degree starting out as a nursing student. All right, because in the end, nobody really want to waste time. We're not time wasters out here, okay? So go ahead and choose whichever one. So ADN versus BSN, whichever one you choose, both of them are going to make you sit the NCLEX. Both of them are going to make you become a registered nurse. But the difference between the two is the time, the money, and the strategy. The ADN is a little bit faster. The Bachelor's is going to take a longer time, but it opens up more doors for you. Let me know which route you're going to be taking. From there, you can ask me any questions that you feel that you have and you're trying to get an answer to it, and I will make a video specifically for you. All right. Until then, I'll see you in the next video. Remember to go ahead and subscribe to my videos. Remember to go ahead and subscribe to I Think Nursing and be a part of the family. Until then, I'll see you in the next video. Bye.